Hello everyone. Today I will discuss in brief regarding sedative and hypnotic drug. The sedative and hypnotic drug can be of broadly two types. One is benzodiazepines and the other group is called as barbiturates. Now these sedative hypnotic drugs are actually used to depress or slow down your body's functions. Often these drugs can be also referred as tranquilizers or sleeping pills or sometimes just as sedatives. So they not only used to calm down an anxious patient or people, promote sleep, they also have other effects, and at the higher dose they can be also misused by the people as a drug of abuse and has a very popular side effect of having a drug dependence, drug tolerance, drug of abuse, and these drugs can even lead to unconsciousness and sudden death. We will discuss about one of the most common group of drugs which are popularly prescribed called as benzodiazepines, which are popularly referred as benzos. These benzodiazepines are classified based upon the duration of action into short acting, which will act for a 3 to 8 hours of period. Example, oxazepam and triazolam. Intermediate group of drugs like alprazolam, lorazepam, estazolam, temazepam, and long-acting drugs, which will be 1 to 3 days, almost 60 to 80 hours, is diazepam, chlordiazepoxide, clorazepam, and clorazepate. Now, what are the pharmacological effects of these drugs? The most common effect is the reduction of the anxiety and the aggression. Second most is sedation and induction of sleep. It basically increases the duration of sleep. There are two stages of sleep. One is rapid eye movement and the stage 2 is non-rapid eye movement. So it increases the duration of a non-rapid eye movement sleep, stage 2 sleep, and decreases the latency of sleep onset. That means you won't struggle to sleep. It decreases the latency of the sleep. Immediately you go into stage 2, which increases the duration of it. Why are they extensively used clinically? Is because they are highly safe. There's a good margin of safety. It has a very little effect on rapid eye movement sleep. Little hepatic microsomal drug metabolizing enzyme effect is there, and very slight physiological and psychological dependence and withdrawal symptoms with these group of drugs, and less adverse effects, maybe a residual drowsiness and incoordination movement with benzodiazepines. I mean very clear that this is not in general to sedative hypnotics, in particular to benzodiazepines only I'm talking about. The third most important pharmacological action is anticonvulsant or maybe an anti-seizure. Muscle relaxant, it's a muscle relaxant systemically used for a muscle relaxant property, and other effects is lead to temporary amnesia. It decreases the dosage of the anesthetic. When you give anesthetic, you can avoid the dosage of anesthetic, and it depresses sometimes respiratory and cardiovascular function in a very minimal way. The mechanism of action is these benzodiazepines act very selectively on GABA A receptors. Now GABA is GABA aminobutyric acid receptors. These are now GABA receptors will all coordinate the GABA neurotransmitter. GABA neurotransmitter, as we all know, is an inhibitory neurotransmitter. So these benzodiazepines act very selectively on GABA, which mediates the fast inhibitory synaptic response produced by GABAergic neurons. The effect of benzodiazepines is to enhance the response to GABA. It basically not only it basically increases the frequency of the channel opening. When I say channel, it's a GABA activated chloride channels. It increases the frequency of opening of chloride channel, but doesn't allow the channel to be open for a longer period. That is what is done by barbiturates. So these benzodiazepines bind specifically to a regulatory site on the receptor, distinct from the GABA binding site, enhanced receptor affinity for GABA by opening up the channel, by increasing the frequency of opening of the channel, so that the ligand gated channels have a lot of activation and GABA is released, which inhibits your central nervous system. The pharmacokinetic effects, it is well absorbed when given orally. They bind very strongly to plasma protein, and their high lipid solubility cause many of them to accumulate gradually in body fat. Metabolic transformation happens in liver through microsomal drug transformation or metabolic enzymes, and basically it leads to glucuronidation of the drug, and it is excreted through urine. So based on this only, it is categorized based upon the pharmacokinetic properties only. It is categorized into short acting, intermediate acting, and long acting. The adverse drug reaction means very few. You may have drowsiness, confusion, amnesia, impaired coordination. Not very uh, tolerant and dependent drug. Very few patients get tolerance and dependence with this drug in comparison to barbiturates. And in toxicities, in acute overdosage, they are considerably less dangerous when compared to the other group of drugs, cause prolonged sleep without any serious depression on respiration. Okay. And then the most important thing is the benzodiazepine antagonist, which is flumazenil. This is the only drug which is available, which is considered as a benzodiazepine antagonist. That means it is used in the conditions of benzodiazepines poisoning, benzodiazepines overdosage, or for a reversal action of anesthesia of when over-induced diazepam is given, flumazenil can be used. It is given intranasally or it's an injectable form which is available. Now, the most important points to be considered before I conclude with benzodiazepines is its difference and its comparison to barbiturates. As I said before, I have already mentioned these points that benzodiazepines are less psychologically and physically dependent drugs compared to barbiturates. Their long-term use is also safe, not as toxic as barbiturates. They induce sleep which mimics natural sleep and refreshing to wake up, and it also doesn't affect more of REM sleep. Increased frequency of GABA chloride channel, which I said, and manageable respiratory depression, not a severe where patient can land into death. So you need to understand the comparison, the contrast and comparison of benzodiazepines and barbiturates. Thank you.